Okay, good evening, guys. Welcome back, everyone. Hope everyone is really doing good with your preparation. And now, in this class of general pathology, let's start our second chapter, that is the inflammation. The previous classes of general pathology, we have mainly discussed about a cell injury, different types of cell injury, reversible cell injury, irreversible cell, different types of cell death, like necrosis, apoptosis, intracellular accumulation, cellular aging. Okay, so all those things were already completed in chapter number 1. Now, in this chapter 2, we are going to talk about a topic called as inflammation. Okay, okay. So, inflammation, the chapter number 2. Now, my question to you. So, what exactly is this inflammation, sir? Every student knows that anything which ends with the letter itis, okay, itis, for example, pancreatitis or any osteitis, okay, endometritis, anything which ends with the letter itis is called as inflammation. Every student knows this basic thing. Okay, dermatitis, you can take what not. But my question for you is, for what exactly is this inflammation? Okay, what exactly is this inflammation? What actually happens in this inflammation? Why? Because in every tissue you will have this inflammation whenever there is some kind of injury happening to the tissue, or whenever some pathology is happening in the tissue, you will say, okay, inflammation is going on. Now, what exactly is this inflammation? Now, before understanding that, see, for example, now I just went to a girl, for example, and I just express my feelings to her. Okay, for example, if I am expressing my feelings in a very good way about her, now she will feel something very good. She will feel nice about me. She will think that, okay, this guy is nice guy. So she is going to respond in a certain type of way. For example, if I go to the same girl and if I behave differently, for example, okay, now she will definitely going to respond in a very bad way. Okay, so in the same way, our tissues will also respond. For example, whenever something is getting affect, like something is affecting the tissue, something is damaging the tissues, some problem is happening in the tissues, now all these tissues will also respond to the injury. So what exactly is this inflammation? So all the tissues, what not in our body, there are different types of tissues. All these tissues will respond to the stimulus, or they will respond to the injury. So here the definition of inflammation is response of tissue to injuries. For example, here is a pancreas. Now, whenever some damage is going on in the pancreas, okay, there is some injury is going on the pancreas. Now, you don't need to worry about the injury. What kind of injury? There can be a bacterial infection or microbiological infection, bacterial, viral, fungal, whatnot. So, there can be a microbiological stress or microbiological injury, or there can be autoimmune injury, or there can be a radiation injury, a toxin mediated injury. So, any tissue can be injured. All these tissues will respond, and that response is called as inflammation. In pancreas, it is called as pancreatitis. In ovaries, it is called as ovaritis. In endometrium, it is called as endometritis. Okay. In heart, it is called as carditis. In bone, it is osteitis. Okay. Now, after explaining to you what exactly is inflammation, for example, if me, okay, if I am having some inflammation going on in my body, so you can actually find out, okay, there is some inflammation going on in this particular area. So there are certain signs with which you can say some inflammation is going on in this particular area, okay, or in this particular tissue. So what are the cardinal signs of inflammation? Okay, so cardinal signs. So what are the cardinal signs of inflammation? So there are 5 cardinal signs which I want you to know. 1, 2, 3, 4 and 5. Now I just want you to think yourself, what are these cardinal signs of inflammation? Let's start with dolor. It's not that dollar which everyone is trying to earn. So dollar, calor, rubor, calor and functionum Dysplasia. Okay, so these are the cardinal signs of inflammation. Now, what are they? See, whenever I use the word dolor, it actually means pain. In the site of inflammation, what do you have? Definitely in this area, for example, particularly in this area, so some infection is happening. Okay, some bacteria, staph aureus bacteria is getting into my skin and it's causing infection in my skin. And here in this particular area, my tissues are reacting to that bacterial agent. Now here I am having inflammation. So if I am having inflammation, definitely I will have some pain over here. That pain is referred as dolor. And calor means temperature. Okay, temperature. So in that particular area, there will be warmth. I should say warmth. Okay, so the temperature in that localized tissue, you see, whenever you see your body is reacting in such a way, if more temperature is there in this particular area, that temperature is not a suitable environment for the microbes to grow. So in that particular area of inflammation, there is more warmth. And why there is warmth, we will discuss later. Okay, because of increased blood flow to that particular area, to that localized region, the temperature is slightly elevated. Okay, that is calor. After that, rubor. Rubor means redness. Okay, and pallor. Okay, sorry guys, I just want to make a small change. Actually, pallor is not seen. Pallor means, like, light, light, right? Pallor means which you will see in anemia. Here I have to actually use the tumor. Okay, just correction. Tumor. Tumor means swelling. Okay, tumor means swelling. So in the area of inflammation, more fluids will come and accumulate. Okay, more fluids will come and accumulate. Why more fluid is coming, we'll discuss in a subsequent slides. But as of now, just remember, tumor means swelling is going to be there in the area of inflammation. And last fellow is functional acia. Okay, or functional acia, whatever. So functional acia means a decrease in the action or decrease in the activity or function. Okay, what does I mean by, for example, if there is some inflammation going on in my joints. Okay, I'm suffering with arthritis. Okay, I'm suffering with arthritis. So here some inflammation is going on. So do you think I will be able to use this joint as normally as you guys? Definitely not. Okay, I can't use my joints like a normal person. So there is loss of function, or there is a decrease in the activity of the um, that particular part. So here important point which I want you to know is, this dolor, calor, rubor, tumor, all these things, okay, they were given by a scientist called as Celsus. Okay, so Celsus, okay, so Celsus is the scientist who gave these four cardinal signs, and the last important fellow is the functional acia. This functional acia was given by Rudolf Virchow. Okay, so who gave the last fifth cardinal sign? The last fifth cardinal sign is functional acia, given by Rudolf Virchow. I know, so most of the students who were studying in your second years and third years, whenever you listen this word Rudolf Virchow, where we have discussed in the previous class, we have discussed Rudolf Virchow is the one who gave the term cellular pathology. Okay, cellular pathology, the term given by Rudolf Virchow. And important points about the Rudolf Virchow is, this guy, this scientist, he gave a triad called as Virchow triad. Okay, Virchow triad. So what exactly is this Virchow triad explains us? Okay, even in the subsequent lectures we will discuss about this. Rudolf Virchow, he gave a triad where there is endothelial injury. Very, very important guys. Just wait, I will explain. Endothelial, endothelial injury. Okay, endothelial injury, alteration of blood flow, alteration of BF. Okay, BF is not your boyfriend. Alteration of blood flow. This alteration of blood flow can either be stasis, or turbulence. So don't worry, what exactly I am speaking will make you sense in just a minute. But just see, Rudolf Virchow is the person who gave the last cardinal sign, that is the functional acia. Now, the same Rudolf Virchow have also contributed something to our pathology, which is called as a that Virchow triad. Now, this Virchow triad, it consists of three things. What are they? First thing is endothelial injury, alteration of blood flow, stasis and turbulence, and last one hypercoagulability. Okay, hypercoagulable states. Okay. Now you will ask me, sir, what exactly is this Virchow triad trying to explain us? See, this Virchow triad are these are the conditions like endothelial injury to the endothelial injury, alteration in the blood flow pattern. Normally our blood flow pattern is something laminar blood flow. Okay, so alterations like stasis, that is sluggish flow of the blood, or turbulence and hypercoagulable states. In certain diseases, you will have hypercoagulability in your blood. So all these are the factors which are responsible for formation of thrombus. Okay. So thrombus, why do we form thrombus? Intracellular blood clot unnecessarily. Why this thrombus will form? The thrombus formation is explained by the Virchow triad. Now, apart from that, what else you need to know regarding the Virchow triad? Okay, this Rudolf Virchow, actually I should mention here, he is the father of modern pathology. Okay, let me write it down here. He is the father of modern modern pathology. Okay, so the one thing, he is the father of modern pathology, and he is the one who coined the term cellular pathology, and and one more contribution is that Virchow triad. Apart from that, I just want you to know there is something called as a very important Virchow node. Virchow node. Okay, so what exactly is this Virchow node? Especially whenever we study about the gastric pathology, there we will get this. Virchow node is a supraclavicular lymph node. Okay, especially it is left supraclavicular lymph node. Okay, so it's the left side supraclavicular lymph node. See, you can call it simply like supraclavicular lymph node, right? But why we are calling it as Virchow node? See, whenever you having a gastric cancer, we all know cancers are having something. What is that? Something special about the cancers? No, these cancerous cells are these neoplastic cells. They will jump into the blood. Okay, they will jump into the blood vessels, and from there they will start to metastasize to different organs and lymph nodes and all the stuff. So now gastric carcinoma, now these cancerous cells, now they will start to metastasize, and now they are going to come and get lodged in the supraclavicular lymph node, left supraclavicular lymph node. Once the metastasis happens, now this left supraclavicular lymph node is called as Virchow node. Okay, gastric cancer is now going to come and metastasize. Okay, metastasize into the left supraclavicular lymph node, then it is called as Virchow node. Now after this, okay, now after discussing the basics, now let's really discuss about the types of inflammation. Okay, types. Okay, now inflammation was mainly divided into two types. Now if you ask me, generally speaking, the things which I want you to know is, so the first type is called as acute inflammation. Okay, acute, there is nothing cute about this acute inflammation. Acute inflammation. And second type is chronic inflammation. Acute inflammation, chronic inflammation. So what exactly is the difference between, okay, if you want to know what exactly is the difference between acute inflammation, very simple, try to understand like this. For example, right now, you just take a matchbox, okay, you just take a matchbox or you just take a pin, you just try to burn yourself. Okay, anyway, don't take my advice, but whenever, okay, you are having a pinprick, or whenever you touch a very hot object, okay, so definitely your tissues are going to be injured, right? Your tissues is going to be injured. So immediately you will have, within a matter of a few minutes, you are going to have swelling in that area. Your tissues are actually reacting. So what exactly is going on in that particular area? Inflammation is going on. Which type of inflammation, sir? Acute inflammation, not the chronic inflammation. So acute inflammation begins just like that, within matter of minutes. Okay, so acute inflammation, like, it is acute because it starts within minutes, And now see, now today night you have some injury at this particular point, for example, okay, you touch something very hot or you touch something very spiny, so some injury have happened and immediately you are going to have inflammation in that particular area. And my question for you is, that inflammation is going to continue for the next 1 year? Do you think that inflammation is going to continue for the next 1 year? Definitely not, right? Definitely not. That inflammation is going to subside within the next 1 day or 2 days. So it also ends, okay, acute inflammation ends quickly. Okay, so rapid in onset, and the duration component is also going to be very small. Okay, it starts rapidly and it also ends rapidly. That's it. So that's what exactly is acute inflammation. Most of the students go crazy, like, explaining what exactly is acute and chronic. Simple, starts very quickly and also ends very quickly. Okay, now what the hell is this chronic inflammation, sir? Now come see, whenever you have certain ailments in your body or chronic diseases in your body, okay, chronic diseases, the chronic diseases in your body, for example, that disease is not going to occur in 1 day and it's not going to end in 1 day. For example, you are having a rheumatic arthritis. You all know this, right? Rheumatoid arthritis. Now, what exactly is this rheumatoid arthritis? We all know it's an autoimmune disease where continuously antibodies are being generated. Now, these antibodies are getting lodged in the joints and continuously these antibodies are destroying your joints. So, this process is going to happen overnight. This process is going to happen only during that one particular night. No, continuously, lifelong. For 5 years, 10 years, this disease is now present in the body. So, inflammation is there in these joints. But this type of inflammation is going to subside within 1 2 days. No, the inflammation is present for years together. So such a type of inflammation, if the damage is continuous, it's happening throughout the day 24 by 7 or in long duration, now then the type of inflammation which you will have in that particular tissue is going to be chronic inflammation. Okay, so example is rheumatoid arthritis or SLE, systemic lupus erythematosus, so autoimmune disorders or cancers. Okay, so in all these diseases you are going to have chronic inflammation. So inflammation is divided mainly into two types. That's acute inflammation and chronic inflammation. Mainly depends on what? Based on what? Based on the duration component. Based on duration. So based on duration, we have divided the inflammation into groups, acute and chronic inflammation. Okay. Guys, is it clear? Shall I go forward? Okay, I'm checking. Okay. So I have discussed with you the two types of inflammation. Now let's go further. Okay. Now, so in acute inflammation, okay, in acute inflammation, what are the events which are happening in the tissues, and in the chronic inflammation? Okay, in chronic inflammation, what exactly, who is actually doing all the stuff? See, whenever I have an acute inflammation in my body, okay, now just think that, like, someone close to me, or some, like, the girl is coming to me and she's going to prick me. Okay, she's going to prick on my hand. She's going to prick with a pin on my tissues. Okay, just imagine that she is a sadist and now she's pricking on my head, on my skin. So definitely some tissue is getting damaged, right? Now in this tissue, acute inflammation is started. Now my point is, what is the major cell, okay, what is the most important cell who is mediating the process of acute inflammation? This is a repeatedly asked question. The most important cell who is mediating the acute inflammation is neutrophil. Neutrophils. Okay, neutrophils. Which type of WBC? It's a neutrophils. Okay. Now, chronic inflammation is mainly mediated by macrophages. Macrophages. An important point is this is universal. Like, so in all the acute inflammations, neutrophils play the major role, and in all the chronic inflammations, macrophages plays a major role. Now, but exceptions here are, so there is this acute inflammation called as enteric fever. Enteric fever. Now, what exactly is enteric fever? I just want you to think yourself. Enteric fever is nothing but the other name for typhoid. Okay, it's the other name for typhoid. Now, in the typhoid, see, typhoid, is it a chronic infection or acute infection? I'm asking you. Today you just went to some local street vendor, you are just taking some street food, definitely sure that the hygiene in those particular places is going to be horrible. You can't even expect. Okay, anyway, you are tempted to eat in those that particular places. Okay, now you have taken some local street food. Now definitely in contaminated foods, who is going to stay? Salmonella is going to Salmonella. Okay, Salmonella typhi. Now, Salmonella typhi is going to enter into your body via fecal-oral route. Okay, via fecal-oral route, it is going to enter into your body, and that causes enteric fever. And this enteric fever, do you think it is going to stay for years together? Definitely not. This is going to cause acute inflammation, no doubt. Okay, it's going to cause acute inflammation. Now, my question to you: if it is acute inflammation, definitely the major number of the major cell which should increase in your body, the major cell that should increase in your body should be neutrophils. But in this condition, this is an exception, right? This is an exception. In this condition, it's the lymphocytes. Lymphocyte number. Lymphocytes are going to increase predominantly. There will be lymphocytosis, not the neutrophils. This is one important exception. Usually in chronic infections, who should dominate? Who should dominate? It's the macrophages should dominate. But the other exception is, so there is a chronic infection called as chronic pseudomonas infections. Okay, chronic pseudomonal infections. Okay, we all have studied that pseudomonas. It causes different types of, like, Zakuzi syndrome, heart of folliculitis. Okay, now the pseudomonas organism, if it causes chronic infection, I mean pseudomonal infections, it's not the macrophages who are going to increase predominantly. It's not the macrophages. Here, neutrophils are going to be predominant. Neutrophils, guys. Okay, neutrophils are going to be predominant, not the macrophages. The exceptions also completed. Now, after discussing about the exceptions, now let's jump into our major topic, that is acute inflammation. Okay, acute acute inflammation. Now in this today's class, our target is to complete acute inflammation. So what exactly happens in this acute inflammation? Duration wise, it's going to happen in a very particular limited time. Okay, and one more important point is acute inflammation. It starts very rapidly, it ends rapidly. Important point in acute inflammation, the more number of the predominant cell is going to be neutrophil. Okay, now acute inflammation, what are the events, sir? What are the events which happens in the acute inflammation? The two major events are cellular events, cellular events and vascular events. I should actually write like this. Okay, cellular events, I should actually put it down here. And first event is vascular events. Vascular events. So what does that mean by? So see, now let's take a scenario something like this. Now I have some infection which is happening in this area. Okay, in my hand, some infection is happening. Okay, some bacteria, might be Staphylococcus aureus or Staph epidermidis, have gone into my tissue. It have gone into my tissue. So immediately my tissue is getting injured by that bacteria. My tissue is now responding in the form of acute inflammation. Now what happens? First event, when your tissue is undergoing inflammation, what exactly happens? First changes are going to be seen with the blood vessels. Okay, first changes are going to be seen with the blood vessels. So that's why it is called as the vascular changes or vascular events will occur. Nextly, my tissue, into my tissue, WBCs should have to come, right. Okay, here is some bacteria growing, some damage is happening to in this area. My body knows, oh my god, some fellow is sitting over here, some harmful fellow is sitting over here. So what will do? Now the WBCs from my body, the WBCs should have to come to this particular area and have to neutralize the bacteria. So some cellular changes will happen, some cellular events will happen. So followed by vascular events, there will be cellular events. So now we have to start with what? We have to start with the topic of vascular events. Okay, vascular events. Okay, now what exactly are these vascular events, sir? Okay, now what exactly happens? See, now here there are four important steps in the vascular events. Okay, let me write it down here for you. The first vascular event is vasoconstriction. Vasoconstriction. Second one is vasodilation. Okay, these are the events happening initially. Third event is going to be increased vascular permeability. The fourth event is going to be stasis. Okay, these are the four vascular events. Now let's go one by one. So what exactly is this vasoconstriction? Why vasoconstriction is happening? Okay, now see, whenever there is an injury, okay, your tissue doesn't know what kind of injury. For example, see, whenever someone comes and cuts here, okay, now immediately what will happen? Immediately, in order to prevent the blood loss, okay, see, this event is not that important. Okay, it doesn't have a very important significance. For example, especially whenever there is some bad injury to the tissues, in order to prevent the blood loss, okay, in order to prevent the blood loss, what will happen? Immediately the blood vessels will undergo constriction. There will be neurogenic reflex. Okay, there will be neurogenic reflex which causes immediate constriction of the blood vessels to prevent the loss of blood. Okay, so which is very transient response. It's going to happen for just for seconds. It's a transient. Okay, for example, think like this. Now, whenever someone comes to you, you are just very much joyful. Okay, you are a joyful fellow, and you are simply like just roaming on the streets. For example, someone comes to you. Okay, suddenly they give a hit to you. Okay, someone suddenly come to you and suddenly they hit you. Now, for a moment, okay, for a few seconds, what will happen? You didn't understand what's happening with you. Okay, you might be absolutely strengthy, you might be absolutely like muscular, but just for a moment of time, what you will try to do, you'll just try to move away from that area. Okay, you got totally blank out and you just don't know what to do. So that kind of response is this vasoconstriction. But after a few seconds, what you will do, what will happen? You are going to get back to your consciousness, and you will feel like, okay, who the hell is this man? And you will actually try to respond, you will actually try to fight against him. So that's what happens in vasodilation. First there will be vasoconstriction, okay, for a transient period of time, but later what happens? Actually now vasodilation will happen. So what exactly is happening with this vasodilation? Now see guys, vasodilation, here is the area. Okay, why this vasodilation is happening? If you think, this is the area where microbe is present, that Staph aureus is present. So what you have to do? You have to kill that bacteria, you have to neutralize that bacteria. How you can actually neutralize that bacteria? By sending more amount of WBCs here. So what should happen in this area? There will be localized vasodilation. Localized, not the entire systemic vasodilation. There will be localized vasodilation that's happening in this area. Now, whenever there is vasodilation happening in that area, more blood is going to that particular area. Whenever more blood is going there, more WBCs will go there. More complement proteins will go there. More macrophages, more neutrophils, more antibodies will go to that particular area. Okay, so that the bacteria will be neutralized. Okay, so vasodilation, that is the process of vasodilation. Okay, now my question for you is, see, in your exam they will ask you, what is the first vascular event? The first vascular event is, okay, first vascular event is vasoconstriction. And is vasoconstriction is going to be prolonged and sustained? No, vasoconstriction is not prolonged, it's a transient response. Now comes the question, vasodilation. See, blood vessels are getting dilated, right, in this particular area. Now why? Why this is getting dilated? Okay, why this is getting dilated? Now, because in the area of inflammation, histamine is going to be released from the mast cells, especially in this particular area. In all your tissues, there are mast cells present. Now, these mast cells, they will release histamine. Okay, histamine. Histamine is present. So, what exactly is this histamine? Histamine is a mediator. Okay, histamine is a mediator which is causing vasodilation. Histamine is a mediator which is causing the vasodilation. Now, my point to you is, so whenever vasodilation happens, now this vasodilation, let me write it down here. Vasodilation, vasodilation. Okay, now whenever vasodilation happens, see, now this vasodilation, it increases the blood flow, no doubt, it increases the blood flow, right? Okay, now this vasodilation is because of the histamine, no doubt, it's because of the histamine. My point is, whenever vasodilation happens, more blood flow is going there, So more blood flow goes to that particular area means that particular area of inflammation will become red or not? Yes. So the redness is called as rubor. So rubor, the cardinal sign, rubor. So rubor, the cardinal sign is because of vasoconstriction, increased vasopermeability, stasis, or is it because of vasodilation? So rubor, that's the redness. Okay, redness is because of the vasodilation. Whenever more blood flow occurs to that particular area, will that area become more warmth or not? Yes, it will become more warm. So there will be increased temperature in that particular area. So increased temperature is called as calor. Okay. So calor and rubor important. So calor and rubor are because of which vascular event? They are because of the vasodilation. They are because of vasodilation. Okay. Now after this, what is the next event? So we have discussed about the vasoconstriction, which is transient. This completed. After that, we have also discussed about the vasodilation. Now after this, we have to discuss about increased vascular permeability. Now what exactly is this increased vascular permeability? Okay, in the name itself is there. Increase. Something is increasing. Where? In the vessel. So vascular permeability. Something is getting permitted. Okay, what is that? See, normally, let's take this as a blood vessel. Okay, if you see this as a blood vessel, okay, now it's already dilated. Now these blood vessels, they are lined by what? They are lined by the endothelial cells like this. Okay, here on one side I am showing you these are the endothelial cells. Okay, now what happens? Dilation is done. Now what happens is increased vascular permeability. It means now, okay, let me first draw this side also. Now what happens is, see here is the plasma. Okay, plasma with lot of cells. Okay, with lot of cells are there, also plasma proteins are there. Okay, the fluid is there. Now what happens in increased vascular permeability is, now the fluid which is present in the blood vessel, okay, the plasma which is present in the blood vessel, see this is the tissue. Okay, let's take tissue here. Okay, this is the tissue where inflammation is happening. Okay, okay, inflammation is happening in this particular area. Okay, so this area is very sad. Now what happens, sir? Now all this plasma is now fluid component is coming to the tissue. Now is this good or bad? Definitely this is good. See, inflammation is going on. Tissue is responding. See, inflammation is good or bad if you ask me. Inflammation is actually good. Why? Because tissue is responding. Tissue is allowing the WBC to come. Tissue is allowing the plasma to come to this area. Why? Because plasma is rich in proteins. Complement proteins are there. This in the plasma or in this blood, there are WBCs. WBCs have to come to this particular area. So more fluid is going means it's not just only the plasma. Along with the plasma, proteins are going, antibodies are going, complement proteins are going, even WBCs will go, RBCs will go. So now there is shifting. So permeability. Now these vessels now become more leaky. So permeability is the word. You should remember permeability means now vessels are becoming more leaky. Okay, vessels becomes more leaky. Okay, vessels become more leaky. Now here comes the question. So now if more fluid is shifting, now the fluid is shifting into the tissues means, now will the tissue swell or not? Definitely tissues are going to swell. So the area of inflammation, is it going to swell or not? Definitely it's going to swell. So that causes the next cardinal sign, that is called as tumor. Okay, tumor here is not meant by the cancer. Okay, there is nothing like, there is no relation between that tumor and this tumor. The tumor here means swelling. So now tumor is because of which vascular event? It's because of the increased vascular permeability. Now comes the question. So what are the mechanisms of increased vascular permeability? Mechanisms of increased vascular permeability. Okay, the mechanisms of increased vascular permeability means what events leading to more leaky blood vessels? Why the blood vessels are becoming more leaky? There are important mechanisms which I want you to know. There are like 4 5 mechanisms for that. The first mechanism is endothelial cell. cell contraction. You can also call it as endothelial cell contraction or retraction. So what exactly happens, sir? Let me write down here, put it down here. So this is the endothelial, this is the blood vessel. Now all the blood vessels are lined by endothelial cells, right? Normally there are no gaps between the endothelial cells. There are no gaps. Okay. But here now what happens is, in the area of inflammation, the blood vessels are, what's happening with the blood vessels is, now these endothelial cells, now they are contracting. You know, they are contracting. Now these endothelial cells are acted upon by certain substances. There are certain mediators which are coming. See, please concentrate on my words. There are certain mediators or chemicals coming from the area of inflammation. Now these chemicals will come and act on the blood vessels, especially the capillaries, venules. Now what happens? Now these these endothelial cells, now the endothelial cells are moving apart from each other. Now when they move apart from each other, there is a gap created. Now through these gaps, now fluid starts to leak. Okay, now fluid start to leak into where? Into the tissue. Okay, so this is one mechanism. Endothelial cell contraction and endothelial cell retraction is the first mechanism of increased vascular permeability. Now comes the question is, so this endothelial cell contraction or retraction is the most common mechanism. It's the most common mechanism of increased vascular permeability. Now, second important question is, what are the mediators, sir? So what are the mediators which are responsible for this endothelial cell contraction or retraction? The mediator which I want you to know is histamine again. Okay, the first mediator is histamine and serotonin. Okay, now if someone comes to you and asks you what is the major mechanism of increased vascular permeability, please, or serotonin. Now, before going to discuss anything, one important point which I just forgot to mention to you. So, see, this increased vascular permeability. Okay, let me show you here. See, this increased vascular permeability. One important point which I forgot is, this increased vascular permeability is the hallmark. It's a hallmark. Okay, it's the most important event out of all the vascular events. The most important, the hallmark event of acute inflammation. Okay, AI doesn't mean autoimmune disease. It's the hallmark of acute inflammation. Okay, so something like a pathognomic, even we have discussed in the previous classes, what is the pathognomic feature of rheumatic heart disease? Ash of bodies. What is the pathognomic of irreversible cell injury? Irreversible cell injury, it is dense flocculent mitochondrial depositions, like the calcium depositions, dense flocculent mitochondrial densities are the hallmark. In the same way, the hallmark of acute inflammation is increased vascular permeability. Okay, and this increased vascular permeability is because of first most common mechanism, that is the endothelial cell contraction or retraction. They are one and the same. Endothelial cell contraction and retraction, they are almost one and the same. There is not big differences. Now second mechanism is direct damage to endothelial cells. Direct damage to endothelial cells. For example, see, some trauma have happened. Okay, some trauma have happened. So that in the localized area, so trauma have happened, right? So trauma is already done. Now the blood vessels are also getting damaged or not? Yes. The endothelial cells are also getting damaged or not? Yes. So what happens is, some endothelial cells are damaged. So when endothelial cells are damaged, so what happens? Now there is a gap. Okay. For example, okay, let me draw a new image so that it will be clear for you. So here what I am saying is, so because of the injury or because of the trauma, whatever the reason, or just take, there is a microbe here. Now that microbe is directly causing damage to the endothelial cells. Now this is how endothelial cells are supposed to be, like without any gaps. Now what happened is, endothelial cell is dead. Okay, one endothelial cell is dead because of the trauma or whatever might be the reason. Now when endothelial cells are damaged, now gaps are there and the fluid is now getting leaked into the tissue compartment. So this is direct endothelial injury. Okay, direct endothelial injury. Next thing is leukocyte, leukocyte mediated injury. Okay, leukocyte mediated injury. Now what happens is, see, in an area of inflammation, WBCs will start to come. For example, see here, now this WBC is coming. Okay, it's a neutrophil, for example, to the area of inflammation. Okay, inflammation is happening on the body. So now what is happening is this, what have happened, screen got, okay, now it's okay. Okay, anyway, let's continue. Now these are the WBCs. Okay, neutrophils. Now what happens is, to the area of inflammation, more and more neutrophils starts to come. Now these neutrophils are like, they are the policemen, right? They are having the dangerous weapons. Now in the process of attacking the microbe, they will also start to damage because of the chemical mediators. Okay, these WBCs will start to now produce the chemical mediators. Now these chemical mediators not only attack, not only damage the microbe, to a certain degree they will also affect your own cells. They will also affect the endothelial cells. So this is endothelial injury, which is mediated by the WBC or leukocytes. So the third one is a leukocyte mediated injury. Endothelial cell gone, so more permeability is there, now next mechanism is transcytosis. Transcytosis. Now, what exactly is this transcytosis? And the name itself is there. This is not diapedesis. This is a transcytosis. Trans means through the cells. Cytosis means cell. Trans means through. So, trans means through. Cytosis means cell, means via cell fluid is now leaking. So, what exactly happens in the transcytosis? See, now again take a blood vessel. Okay, here is the endothelial cell. These are the endothelial cells. I am just zooming the endothelial cells. I am just making it out of proportion so that you can understand. Now the water or the plasma, whatever is there, okay, the fluids, I shouldn't say water, it's a plasma. Now this plasma now is leaking into the tissue through the cell, not between the cell, through the cell. For that, definitely see the endothelial cells in a normal person, they are not leaky, they are not permeable. But now because of the presence of a protein, okay, here in the endothelial cell, now a protein is going to be incorporated here. Okay, so with the help of that protein, now the plasma is now leaking into the tissue. This is very, very important. I want you to know. See, the name of this protein is called as a vascular organelle. Okay, this name of this protein is called as vascular vacuolar vacuolar organelle. So with the help of this vacuolar organelle, now fluid is now shifting into the tissue. Okay, so other important points what you need to know, sir. The mediators. Why during inflammation? Why especially during inflammation these endothelial cells are becoming leaky? So there should be mediators. From the area of inflammation, certain mediators should come and should act on the endothelial cells. Then only this VV organelle is going to be incorporated. Then only the fluid is going to shift. Now the mediators important. Okay, transcytosis is because of which mediators? Okay, it's because of which mediators? Important is vascular endothelial growth factor as well as histamine. Okay, histamine is going to come everywhere. It is vascular endothelial growth factor, VEGF. Very, very important, vascular endothelial growth factor. See, apart from here, there is one more place where vascular endothelial growth factor will come. It will come within just 2 minutes. Just for now, remember vascular endothelial growth factor and histamine. Histamine. What is the major source of histamine? If someone comes to you and asks you, the major source of histamine is mast cells. Mast cells. So from the area of inflammation, these two substances are getting produced. They will act on the endothelial cells, and endothelial cells will become more leaky to plasma with the help of VV organelle or vacuolar organelle. Done. Now the fifth mechanism of increased vascular permeability. What are the other ways through which the vessels are becoming more leaky? Is the angiogenesis. Okay, angiogenesis is the one mechanism through which the tissues are getting more and more fluid. Now, if you ask me what exactly is the name angiogenesis? Angio means what? Blood vessel. Genesis means what? Now, new blood vessels are forming. Okay, so in the area of inflammation, okay, it's not a rapid event. Anyway, if an acute inflammation is happening on this particular area, okay, inflammation have started. Now it's just only 2-3 days. Okay, now it's not years. It's not like months and years. Now acute inflammation is happening in this area. Now, do you want more fluid in this area or not? Yes, you want more fluid in this area. Actually speaking, you want more blood flow to this area so that more cells will come, more antibodies will come, more competent proteins will come to neutralize the bacteria. So if you want more blood, there is vasodilation happening. Second thing, increased vascular permeability is happening. And now new blood vessels, immature blood vessels, new blood vessels will start to come to this area. New blood vessels are coming to this area. Remember, your new blood vessels, they are not having a proper junctions in between the endothelial cells. They are not tight. Okay, now they are more leaky. So in angiogenesis, what happens? Angiogenesis, immature blood vessels are forming. Immature blood vessels. Okay, immature blood vessels are forming. Now these immature blood vessels, are they going to have a tight junctions? Are they going to be tight, plasma tight? No, they are leaky. As they are leaky, now fluid will shift into the tissues. Okay, plasma is going to come into the tissue. So this is how you are going to have increased vascular permeability. Now just tell me guys, what are the mechanisms of increased vascular permeability? The 5 important mechanisms of increased vascular permeability are endothelial cell contraction retraction, which is the most common. Next thing is direct damage to the endothelial cells. Okay, direct damage to the endothelial cells, and leukocyte mediated injury, and transcytosis. In transcytosis, important organelle I have given you, it is a vesiculovascular organelle, and the mediators which are causing the transcytosis is vascular endothelial growth factor as well as histamine. But here, see, repeatedly ask MCQ, what is that mediator? Important mediator for the formation of new blood vessels. Angiogenesis is again vascular endothelial growth factor, VEGF. Okay, so the name itself, it is a vascular, means blood vessel, endothelial growth factor. So it's helping in the formation of new blood vessels or immature blood vessels. So VEGF is the most important mediator for angiogenesis. Okay, now having said that, having said that, now we are done with the, okay, not done. See, we have discussed the 3 important vascular events. Vasoconstriction is done, vasodilation is done. Now vascular permeability and its mechanisms are also done. Now what is the last vascular event? In the area of inflammation, okay, what happens is a stasis will happen. Okay, so what exactly is this stasis? So, okay, means stasis means blood is coming, no doubt, more blood is coming, but the blood is moving very, very slowly. Stasis is happening. Now, why this stasis will happen? Simple. Now, just see like this. This is a blood vessel. Okay, blood vessel. Inside the blood vessel, who is going to have? Who is going to stay? So there is plasma. Okay, plasma with all the cells. Okay, the plasma with the cells. Plasma plus cells are going to be there. Now what happens during inflammation? Plasma is going to leak out or not? Plasma is going to leak out of the blood vessel. Now when plasma is leaking out, what happened to the concentration of the blood? The concentration of the blood is going to be increased. Now all the cells, okay, most of the cells are still present in the blood vessel only. Okay, cells to a certain degree, okay, to a certain degree cells will also come along with the fluid, but cells are staying in the blood vessels. Mainly the plasma is leaking into the tissue. Now what happens is all the cells, now they are aggregating with one another. Okay, you are taking out the fluid. So all the blood is now getting more and more concentrated. Do you think this concentrated blood will go more fastly? Definitely not. So blood is now moving very, very slowly. So this is called as stasis. Okay. So blood flow is going to be decreased. Blood flow is going to be decreased. Blood is going very, very slowly. Okay, in that particular area, slowly. This is very, very good. Why? Because the movement of the blood should be slow enough so that the required cells from the blood vessel, the required cells, the WBC, will have enough time to cross the blood vessel and it have to enter into the tissue. So blood is moving slowly, but now WBCs, they have enough time to move from the blood vessel into the tissue. So transmigration from the blood vessel, now it have to move into the tissue. This is called as a diapedesis or transmigration. We'll discuss. So with this, what we have completed, guys? We have completed the vascular events of inflammation, vascular changes, vessel changes. Now after this, what else we have to study? After vascular events, we have to study about the cellular events. Means some changes are going to happen in the cells. Which cells? Mainly the WBCs. Now what are those cellular events? Okay. Now let's take a heading: cellular events. cellular events. Let's go one by one. See, now let me show you a blood vessel like this. Here is a blood vessel. Okay, here is a tissue. It is inflamed tissue. Here is a tissue. Normally, see, in your blood vessel, the flow of blood is not something like random zigzag motion is not going to be there. The blood is moving absolutely in a very streamlined fashion. That streamlined flow of blood is called as laminar flow. Okay, where RBCs are going to be in the center, RBCs are going to be in the center of the blood vessel. So all the time your RBCs, they are present, they are going in central column. Surrounding the RBCs, you are going to have your WBCs. RBCs are surrounded by WBCs. Let me show you here. RBCs are going to be surrounded by the WBCs. Now, where do you want your WBCs to be? Here in the tissue. Who is present in the tissue? There is this bacteria present. Okay, in the tissue there is bacteria. This bad guy is there. Okay, E. coli, Staph aureus, Staph epidermidis. This bad fellow is there. Okay. Now, where do you want your WBCs to be? Your WBCs should have to come into the area of tissue. Now, for that process, first event is now this our soldiers. Okay, our soldiers should have to move to the periphery of the blood vessel. We should have to move to the periphery of the blood vessel. So that movement is called as margination. The first event is margination. Okay, so they are coming to the margin of the blood vessel. Okay, normally who is there here? Here are the endothelium. Okay, here is the endothelial cells. Now they are marginate. This is the first event, margination. Okay, now after margination, what should happen? See, you want this WBC where? Here in this particular area. Now after margination, second cellular event. Okay, margination is the first cellular event. After margination, the second cellular event is rolling. So what exactly happens in the rolling? You know rolling, right? Rolling. Okay, it's like the cells are rolling. Where the cells are rolling? See, the second event is again. Let's take a blood vessel. This. Now here are the endothelial cells. Usually the WBCs are not going to come into contact with the endothelial cells. Okay. Now what happens is, see, this is your marginated WBC, marginated neutrophil. Now it is marginated. Now it is going to come towards the endothelial cells. Important point is on the endothelial cells there are certain important molecules present. Okay, there are certain important molecules present. Now they are going to bind with the. Let me show you on the WBC also, on the neutrophils also there are certain important molecules. Now for the first time they are coming near to the endothelial cells. For example, when you go to a new place, so whenever you go to new place, what will happen? You are now seeing new people, right? New people. Now what you try to do? You will just try to have a handshake. Okay, in the same way, now these WBCs, now they are coming towards the endothelial cells. Now what they will do? Now they are going to have a handshake. Now, with the new people, are you going to have a continuous handshake for like a minute of for 2 3 continuous minutes? No, no, right? You are going to give a handshake, you are going to take it back. And with the new people, you are going to give handshake and take it back. New handshake, take it back. Okay, you are meeting new people, just handshake, and you are taking your hand back. So in the same way, first what happens is margination happens. After that, handshaking. That handshaking is nothing but here rolling. Okay, rolling means not continuous sticking, not continuously sticking. Now there is attachment, detachment, attachment and detachment. Okay, so the neutrophil here, this WBC is binding and moving like this. Okay, it's rolling on the endothelial cell, rolling. So the second cellular event which I want you to know is rolling cell. Now here, handshake, we are using the hands. Okay, two hands of two different persons. Now here endothelial cell is there. Important point, very important for your exams. Here is our endothelial cell. Endothelial cell. And the other person here is your neutrophil or WBC. Neutrophil. So now on the endothelial cells, who is that hand? Like or what is that molecule which is helping in the attachment on the endothelial cell? This molecule, which I am just showing you here, this molecule is called as the selectin. Okay, selectins. Okay, selectins. The CD marker of selectin is very important, which is repeatedly asked. The CD marker is CD34. Very important, guys. Selectin CD marker is CD34, and there are different types of selectins: P selectins, E selectins, L selectins. Okay, P selectin, E selectin, and L selectin. P means platelet, the selectins which is present on the platelet selectins. E for endothelial selectins, L for leukocyte selectins. Not needed. Selectins are there on endothelial cells. Okay, well and good. What is the CD marker of selectins? CD marker of selectins is, sir, CD34. Okay. Now, on the neutrophil, there are again molecules present. These molecules are also helping in the adhesion, right? The bonding. Okay, not a tight bond, but a loose bond. So these molecules are called as silyl UV6. Silyl UV6. So silyl UV6 is present on what? So silyl UV6 is present on the WBC. So silyl UV6 is going to bind with the selectins, which forms a bond, but which is not strong enough. So that attachment, detachment. So these cells are moving. Now direct question to you. For the process of rolling, okay, in the process of rolling this cellular event, which molecules are involved? Selectins are involved in margination, rolling, adhesion, transmigration, chemotaxis. Which event? They are helping in rolling event, rolling. Now, after rolling, the third event which I want you to know is adhesion. Okay, adhesion. The name itself is there. Adhesion means attachment, tightly attached. Now, you went to a party. First, you marginated. You went to a party. Now, you are meeting new people. Whenever you are meeting new people, what exactly are you doing? You are just giving a handshake. This handshake is not tight enough, but you are just giving handshake and you are going. That moment, you saw a particular beautiful girl. Okay. Now, are you going to move to some other person? Definitely not. You have given the handshake. This bond is not like a normal bond. This is a very tight bond. Okay. You are not going to leave her hand. Now this is going to be a very tight bond. So that is called as adhesion. Now no longer this WBC or neutrophil is going to roll away. It is going to tightly bound. So this process is called as, this event is called as adhesion. Okay. So now for adhesion, again, here is that beautiful girl, that beautiful endothelial cell. Again here endothelial cell. Again endothelial cell. Okay, let me show you here. This is the blood vessel. Now what have happened? Now here are the endothelial cells. Now our WBC was totally bound. That's it. It's no longer moving. Okay, it's no longer moving. They are absolutely attached to each other. Show you with a different color. Okay, here is our neutrophil. On the neutrophil, there is a molecule present. Okay, again there is it's a totally different type of molecule. Okay, on the endothelium, again there is a totally different type of molecule present. Now they are absolutely bounded together. So this process is called as adhesion. Not just like a rolling, that's a tight bond. Now, important point, sir. Sir, for adhesion, what are the molecules which are present on the endothelial cells, and what are the important molecules which are present on the WBC? Neutrophils. On the endothelial cells, the molecules are called as cellular adhesion molecules. VCAM, VCAM. The vascular means blood vessel, right? Vascular cell adhesion molecule. Vascular cell adhesion molecule. And ICAM. ICAM. Okay, ICAM means intracellular adhesion molecule. Intracellular, not intercellular. Okay, intercellular. In between the cells, the adhesion is happening. So intercellular adhesion molecules are present on the endothelium. Vascular cell adhesion molecules are present on the endothelium. Okay. Now, very important point which I want you to know for your exams. Okay, very important. So, this VCAM and ICAM, they are also having certain important, not certain important. These VCAM and ICAM, they are supposed to bind with the other counterpart, right? Other counterpart means they are going to bound with the molecules which are present on the WBC. What are they, sir? So, this VCAM is going to bound with something called as beta 1 integrin, very important, beta 1 integrins, beta 1 integrins, and ICAM is going to bind with the beta 2 integrins. So now question, sir, this integrins beta 1, beta 2, okay, two types of integrins are there, beta 1, beta 2. Sir, beta 1 integrins are present where? Sir, beta 1 integrins are present on WBC and neutrophils. Okay, beta 1 integrins, beta 2 integrins present on WBC. Cell adhesion molecules, vascular cell adhesion molecule and intercellular adhesion molecule. Intercellular adhesion molecule. They are present where? Endothelial. Now, VCAM binds to Beta 1 integrin. ICAM binds to beta 2 integrin. Beta 2 integrin is not one single molecule. It's a group. It's a family. Okay, beta 1 integrin family. There are many molecules. So beta 1 integrins, it includes what? It includes beta 1 integrins includes VLA4. Okay, VLA4. VLA means very light antigen. Okay, VLA4 is a beta 1 integrin. VLA4 is an example of beta 1 integrin. So VLA4 is going to bind with VLA4 is going to bind with VCAM. Okay, VLA for VCAM, VLA, VCAM, VLA. So the VCAMs. Okay, now I should actually draw it and show you so that it will be clear. So here is a blood vessel. Okay, now what I am saying, okay, let me take one important endothelial cell. Okay, this is the endothelial cell. Now tight bonding is forming, right? Here is our neutrophil. Okay, here is our neutrophil. Okay, now on the surface of this neutrophil, which substances are present? Integrins. Integrins of how many types? Beta 1 integrin, beta 2 integrin. Now let me show you here beta 1 integrin. This is beta 1 integrin. Okay, now this beta 1 integrin example which I am giving is VLA4, very light antigen 4. So names are important, absolutely important. Note VLA4 is a beta 1 integrin. Okay, it's a beta 1 integrin. Now this VLA4 is going to bond with what? So VLA4 is going to bond with a molecule on the endothelial cell which is called as ICAM. This is, sorry, not ICAM, VCAM. It's going to bond with VCAM, vascular cell molecule. Okay, they are going to form a tight bond. This is on one side. On the other side, on the same WBCs, there is also molecule called as beta 2 integrin. This is beta 2 integrin. Now this beta 2 integrin is of again not one single type. Okay, example of beta 1 integrin is VLA4. The example of beta 2 integrin is LFA and MAC. Okay, LFA. See, no need to know about what exactly is this LFA. Lymphocyte, function, assisted, molecule. Okay, amazing. Okay, no need of remembering the full forms. Okay, just simple. LFA is a type of beta 2 integrin. MAC molecule is a type of beta 2 integrin. Now these beta 2 integrins, now they are going to bond with what? Now they are going to bond with ICAM. ICAM. Okay, so here bonding is forming. So with this, at the end of the day, we have adhesion completed. Tight bonding is done. Okay, tight bonding is done. So apart from this, what else we have to know for our exams? Okay, in exams, is there anything important? Just try to recollect, guys. From our cellular pathology, we have discussed about a CD marker called as CD95. CD95 in the apoptosis, in the extrinsic pathway of apoptosis, we have discussed there is something called a CD95, which is a death receptor, FOS, death receptor. Now here in this class, we have discussed about CD34. Okay, CD34, which is nothing but our endothelial cell cluster designation factor. Endothelial cell cluster designation factor is CD34. Now after this, I want you to know, sir, extra points for especially for the exam. Sir, selectins. Okay, selectins are there, right? Okay, let me give 1 minute. Yeah, not selectins, sorry. Yeah, now these integrins are there, right? VCAM, ICAM are going to bind with the integrins, not function. Okay, now these integrins are there, beta 1 integrin, beta 2 integrins. Now I have also given you the examples. Now important point is, sir, what are the CD factor? Okay, CD marker. The CD marker of these molecules is anyone? So the LFA or this MAC, beta 2 integrins especially. The LFA or MAC, the CD marker is CD11. Okay, CD11 important. Okay, the CD marker is CD11. Okay, important MCQ. The question CD11 is the cluster designation factor for the beta 2 integrins. Beta 2 integrins. What else? Now let's talk about the selectins. Selectins are having a CD marker. Don't think this is, CD34 is the marker of selectin. I have already explained to you CD34 is the marker of endothelial cell. Okay, not the selectins. Selectins like P selectin, E selectin and L selectin, their CD marker is CD62. Okay, very important. CD62 is the marker of selectins. So at the end of the day, so it's very clear. See, the questions that will come in your exam is silyl UV6 is going to bond with selectins. So both silyl UV6 and selectins, they are helping in the which process of inflammation? They are actually involved in which process of cellular events? They are involved in rollings. They are involved in rolling. In adhesion, which molecules are involved? On the endothelial cell, cell adhesion molecules are there. On the WBC, there are integrins. How many types of integrins are there? Beta 1 integrin, beta 2 integrin. The beta 2 integrins, the beta 2 integrins, which include LFA and MAC, their cluster disintegration factor is CD. Their cluster disintegration factor is CD11. CD11. And selectins have a cluster disintegration factor of CD62. And endothelial cells have a cluster designation factor of CD34. Okay. With this, we have discussed about the cluster designation factors, as well as we also have discussed about the process of adhesion. Now, after adhesion, let's jump into the next event, that is the fourth cellular event, that is transmigration. Transmigration. Now, this transmigration is also called as diapedesis. This is the exam MCQ. Diapedesis. What exactly is diapedesis and which molecules are involved in diapedesis? The name itself is there. See, trans means through the blood vessel, or via the blood vessel. There is some migration happening. Which migration? Neutrophil migration or WBCs. Now, WBCs, they are trying to come through the blood vessels. For example, let me show you. If this is a blood vessel, okay. Now, here are the endothelial cells. Okay, here are the endothelial cells present. Okay, here are the endothelial cells present. Now, where is our neutrophil present? Now, neutrophil is now totally adhesed. It is adhesed to the endothelial cell. Now, at the end of the day, where it should come? It should have to come into the tissue, sir. It should have to come into the tissue to neutralize the bacteria, to kill the bacteria, to kill the agent, infectious agent. It have to come into the tissue. Okay. Now, what happens is this WBC, now it will try to pass through the, it's now trying to go through or pass through the blood vessel wall. So this process is called as transmigration or diapedesis. Important point is that this transmigration, again, it is mediated by certain important molecules. What are they? So the molecules involved here are called as PECAM. Okay, PECAM. Very important is PECAM, okay, not PECAM, PECAM is also having a cluster designation marker. Okay, this molecule, see, there are molecules here, okay, on the endothelial cells. Okay, there are molecules present. Now, those molecules are the ones which are letting, the WBC to pass through the blood vessel. So, what is the name of those molecules? It's called as a PECAM or also called as CD31. Very important. CD31 is the marker of PECAM. Okay. Now, PECAM helps in which process? Transmigration or diapedesis. Okay. Now, where do we have, guys? Now, see the next event, fifth event. Now, here is a blood vessel. All the vascular events are completed. Now, cellular events also completed. Some important cellular events are completed. Margination, rolling, adhesion, transmigration completed. Now, where is our WBC now? Now, WBC or the neutrophil. Now, it have came into, okay. So, I am showing the neutrophil like this because it's multilobated, right? It's multilobated. So, I am showing you the neutrophil something like this. Now, here is a tissue. Here is a tissue. This is the tissue with bacteria. This is not a sperm. This is a bacteria. Okay. This is a bacteria. Okay, here is a bad guy. Now, this neutrophil have to come where? This neutrophil have to come to the area. Okay, this have to come to the area of inflammation. Now, it have to move, right? This movement, the movement of a neutrophil or WBC, the movement of the neutrophil or WBC to the area of inflammation is called as, here is the inflammation. Okay, this movement is called as chemotaxis. Chemotaxis. So here is a bacteria. Bad fellow is sitting here and causing the inflammation. Okay, this guy is a bad guy. Now my point is, so it's a movement. This movement, is it a multi-directional movement or unidirectional movement? This is one single movement. Okay, it's now the neutrophil is not just roaming around there. It have only one function. It's having only one aim. It will go in one single direction. Okay, it doesn't go in multiple ways. It's directly, okay, one single way. It's a unidirectional movement, not the multi-directional movement. It's a directional movement. Okay, it's a unidirectional movement, sir. Chemotaxis. In exam point of view, what they will ask you, sir, why or how come this neutrophil is directly going to the area of, like, that microbe? Why it is directly going to the area of inflammation? Why it's not going in other directions? Okay, why it is exactly going to that particular area? How come it know that's the place of inflammation? How come means, see here, we all know this bacteria is there, right? This bacteria, like, wherever there is bacteria, usually WBCs will love to go there. Important point is, in the area of inflammation, certain important mediators are produced. See, that the damaged tissue is actually releasing certain important mediators. Now, these mediators are acting like a smell. For example, see, now from the area of inflammation, what actually is getting released? Now, chemical mediators are getting released. Now, these chemical mediators are attracting the neutrophil. So, neutrophil just sniffing and going to that area. Okay, so please see here, from the area of inflammation, who is getting released? Now, the chemical mediators. Okay, these chemical mediators are getting released from the area of inflammation. These chemical mediators are called as chemotactic agents. Chemotactic agents. Okay, chemotactic agents through which the chemotaxis will happen. So why we are calling this event as chemotaxis? Means chemo means chemicals, taxis means movement. So the movement of WBC is happening with the help of certain important chemical mediators. Now comes the question, sir, what are the important chemical mediators which you have to know? So the important chemical mediators are LT before, okay, LT before means leukotriene before, from the tissue it's getting released. Leukotriene before, interleukin 8 and C5A. Okay, C5A. So C5A, interleukin 8 and leukotriene before, these are the chemotactic agents. So they will give you in an exam, all of the following are acting as a chemotactic agents except, for example, they will give you in option number A, B, C, D, LTB4, C5A, C3B and interleukin 8. See, interleukin 8, leukotriene before and interleukin 8, LTB4 and C5A, they are chemotactic agents. But C3B, have I ever mentioned here C3B is an example of chemotactic agent? No, C3B is something totally different, which we will discuss in a minute. C3B is helping in the process of opsonization. But the important chemotactic agents which I want you to know are these. Okay, chemotaxis. Now, neutrophil is moving, coming to the area of inflammation. Now, okay, sir. At the end of the day, neutrophil have came. Okay, neutrophil have came to the area of inflammation. It came here. Neutrophil is now sitting here. Okay, our neutrophil is now very, very angry. Now, what have to happen? Which event should have to happen? Now, the sixth event after chemotaxis is opsonization. Okay, see, this is also a cellular event which is not something mainly related to the neutrophil. Opsonization is something happening on the bacteria. For example, here is a bacteria. Okay, let me take a bacteria or something like that. Okay, this is a bacteria. Okay, now this is our bad guy, right? Now, this bad guy is going to be coated with certain important molecules. Okay, this bad guy is now coated with some important molecules, now making this bacteria more vulnerable to the WBC. So what exactly I am doing is the tissue, see the inflamed tissue, already tissue is injured. Now tissue is very much like affected. Now tissue want to take a revenge. Now the tissue want to take a revenge on this bacteria or this agent. So what the tissue will do, from the tissue, certain important mediators are getting released. Now those mediators are called as opsonins. Okay, so those mediators are called as opsonins. What these opsonins are doing? These opsonins, they will come and get deposit on this bacteria, making the bacteria more vulnerable are making the bacteria more easy for the process of killing by the WBC. What exactly I mean means, for example, it's just like garnishing the bacteria. Now, whenever a bacteria is opsonized with these molecules, now immediately the neutrophil, which is in the area of inflammation, immediately it's going to recognize the bacteria and engulf the bacteria and kill the bacteria. Even with this, without this opsonization, neutrophil can attack the bacteria, but the opsonization process increases the vulnerability, increases the speed. Okay, whenever the bacteria is opsonized, immediately this neutrophil or the macrophage will immediately recognize, okay, this is the target. Immediately neutrophil will come and attack the bacteria, kill the bacteria. Macrophage will come, attack the bacteria, engulf the bacteria, destroy the bacteria. So opsonization process is just like a making the food garnished. Okay, making the food more delicious. So molecules which they will ask you in your exam is, sir, what exactly are these opsonins? Okay, so examples of opsonins they will ask you. Important opsonin which I want you to know is a C3b. Okay, C3b, complement protein number B, C3b is an important opsonin. C3b. Okay, C3b. C5a is a chemotactic agent. C3b is an opsonin. Okay, first molecule and second molecule which I want you to know is FC portion of, okay, FC portion means fragment complement binding portion of IgG. Simply remember IgG antibodies. See, for example, this is a bacteria which is now coated with, what? Now it is coated with the antibodies, IgG antibodies. Which antibodies? IgG antibodies. When a bacteria is coated with IgG antibodies, we can say it is opsonized. The bacteria is opsonized. Now this bacteria is going to be very much recognized. It's going to be easily recognized by the WBC. WBC will come and eat up this bacteria, engulf this bacteria. Okay, so opsonization. What are the opsonins which I want you to know? C3b molecule, and IgG molecule. There are even other molecules like fibrinogen, other things are there, but important are these. Okay. Now, after this, which event should happen? The next event after opsonization is seventh one is phagocytosis. Phagocytosis. Now, what exactly is phagocytosis? Now, here is our neutrophil. Let's take the neutrophil with blue color. Okay, here is a neutrophil with blue color. Okay, this is the neutrophil, our neutrophil. Now, this neutrophil is now very much angry. Here is a bacteria. Okay, here is a bacteria. Now, what this neutrophil will do? Now, neutrophil, it will extend its membrane. Okay, it will extend its membrane. Okay, around the bacteria. It's extending its membrane around the bacteria. Okay, now these extensions are called as pseudopods. Pseudopods. So ultimately, what happens is, now our neutrophil is going to completely engulf. Okay, completely take the bacteria in the form of a vesicle. So inside a vesicle is that bacteria present now. So this vacuole is called as phagosome. This vacuole is called as a phagosome. This vacuole is called as a phagosome. Now, see here, guys, this is our neutrophil which is very, very angry. Now, we have a phagosome with the bacteria inside it. Now, what we have to do? We have to simply see that bacteria? No. What we have to do is we have to kill the bacteria. We have to neutralize this bacteria. Okay, we have to neutralize this bacteria. So, how killing will occur, sir? How killing will occur? Okay, actually, inside your WBC, there is an organelle. Not only WBC, in every organelle, in every cell, there is this organelle present called as a lysosome. Lysosome present. Okay. Okay, there is an organelle called as a lysosome. Now, this lysosome should have to fuse with the phagosome. Okay, lysosome should have to fuse with the phagosome. Then what happens, sir? Killing will occur. How actually killing will occur? There are two important ways. Two types of killing. Okay, two types of killing will occur. So killing is of how many types? Killing the bacteria is of how many types? Of two types. What are they? First type is called as oxygen dependent killing. Oxygen dependent killing, which is most common and most important. And second one is oxygen independent killing. Oxygen independent killing. So what exactly is this oxygen dependent killing, sir, and oxygen independent killing? Oxygen dependent is most important. Oxygen independent is very simple. Now what happens is, for example, now here let's see, here is a lysosome. Okay, here is a lysosome, for example. Now this lysosome is now it fused with what? It is now fused with the phagosome. Okay, now let me show you here. Lysosome is fused with the phagosome. Inside the phagosome, who is sitting? Inside our phagosome, there is this bacteria sitting. Okay, inside the phagosome, there is this bacteria sitting like this, the bad guy, who is about to die. Now what happens, sir? In oxygen dependent killing, okay, in oxygen dependent killing, what happens? The name itself it says oxygen dependent, means we are killing the bacteria with the help of oxygen. So which means we utilize the oxygen, okay, we use the oxygen. Now this oxygen is going to be converted into a free radical. So which free radical, sir? It's going to be converted into a superoxide ion. This superoxide, like this first conversion, this conversion is happening with the help of an enzyme called as, not superoxide dismutase, this conversion happens with the help of an enzyme called as NADPH oxidase. So with the help of an enzyme called as NADPH oxidase, once lysosome, phagosome, once they fuse, now in the lysosome there is an enzyme called as NADPH oxidase. Now this NADPH oxidase is going to convert the oxygen into a free radical which is called as a superoxide ion. This is not a powerful free radical. This is not a powerful free radical. The oxygen dependent, oxygen is being utilized. Now this oxygen is going to be converted into, okay, with the help of enzyme superoxide dismutase, SOD, superoxide dismutase, it is going to be converted into H2O2. That's the hydrogen peroxide, which is also a free radical. But even this hydrogen peroxide is not enough, not powerful enough to kill the bacteria. Now this H2O2 is going to be converted into something very, very powerful, which is called as, with the help of enzyme called as myeloperoxidase. This myeloperoxidase is an enzyme. Now with the help of this enzyme myeloperoxidase, see this with the help of enzyme myeloperoxidase, MPO, this myeloperoxidase actually adds chloride ions. It takes the chloride ions and it adds to the hydrogen peroxide. At the end of the day, we are going to end with a substance called as HOCl. HOCl, hypochlorous acid. Very, very important. The most powerful agent which is available in your body to kill the bacteria is this HOCl. So this is hypochlorous acid. Okay, chlorine. We use chlorine, right, to kill, even for the sanitization purpose, to put into the swimming pool, to put into the wells. Okay, to kill the bacteria, we do usually chlorination. So chloride is very, very powerful. So myeloperoxidase, an enzyme, it binds the chloride ions with the H2O2, forms a free radical called as HOCl. Now this free radical HOCl will powerful enough. It's much more powerful enough to kill the bacteria. Okay, now so with this bacteria is killed. With this the chapter of bacteria is closed. Okay, so this is oxygen dependent killing. The most important enzyme here is, two important enzymes are there. The most important, which I want you to know for the exam purpose, is NADPH oxidase. Now for example, if you are having deficiency of NADPH oxidase, for example, there is a gene called as PHOX gene. Whenever you are having a mutation in POX gene mutation, you are not going to have NADPH oxidase. When you don't have NADPH oxidase, are you able to produce this oxygen burst, the first superoxide ion? Are you going to able to produce this superoxide ion? Without superoxide ion, like the entire process is not going to happen. So you will end up with a disease called as, recurrent infection. You are going to get recurrent infections. So that disease is called as CGD. CGD, chronic granulomatous disease. Okay, let me write it down here. Chronic granulomatous disease. A question asked many times. Chronic granulomatous disease is due to deficiency of NADPH oxidase, where respiratory burst, the first event, respiratory burst, is not to happen. Okay, so with this oxygen dependent killing is completed. For example, there is other type. Okay, the other type is oxygen independent killing. Oxygen independent killing. This is very easy. So in oxygen independent killing, this is not that much effective. Okay, this is not that much effective. So what happens here is simple. Here is your lysosome. Okay, here is your lysosome, here is your phagosome. Okay, here is your phagosome. Both lysosome and phagosome are fused. Here is the bacteria present. Now in the lysosome, okay, now in the lysosome there are different enzymes present. There are different enzymes already present. Okay, so there are different enzymes present. One, two, three, four. There are different enzymes are already there. Now these enzymes or acidic enzymes are going to act on the bacteria. Okay, they are going to act on the bacteria and they are going to kill the bacteria. Now my question to you is, so what are these substances? So what are these substances which are involved in oxygen independent killing? So the substances are, sir, the most important substances are lysozyme, lyso, zyme, which is present in almost all your body secretions. Even in all your body secretions, your tears, in your mucosa, this lysozyme is going to be present in GI secretions, respiratory secretions. Lysozyme, okay, lysozyme is there. Lysozyme, defensins, okay, major basic protein, major basic protein. Okay, lysozyme, defensins, major basic protein, lactoferrin, okay, and catholycidins. Okay, so these are the molecules which are involved in oxygen independent killing. Okay, they are involved in oxygen independent killing, but the most important is the oxygen dependent killing. One important point which I want you to know here is, so this one point is major basic protein. So this major basic protein, it is mainly released from which cells? Which cells? It's present in which cells? Which type of WBC? It's present mainly from the eosinophils. Okay, eosinophils. So major basic protein is majorly coming from the eosinophils. Especially eosinophils are going to be increase in number in allergic infections or parasitic. Okay, so with this we have completed the first topic, the cellular events and the vascular events of acute inflammation. Acute inflammation is completed. Now in the next class we are going to mainly focus on the clinical correlations. Okay, clinical correlations of the acute inflammation. Also, we will discuss the chronic inflammation and associated topics. Hope the class is helpful. If you have any doubts, you just post it in the group. Okay, post it in the Telegram group. I will try to answer. And the PPT. Okay, yesterday I'm not sure whether the yesterday's class PPT is posted or not. So yesterday's class PPT and today's class PPT will be posted in the Telegram group. Okay, guys. Hope the class is helpful. Thank you.